Yesterday, a CBC story ran on some secret recordings of meetings between the Alberta public health officials, led by Dr. Deena Hinshaw, and political officials from the government. And the allegation is that Dr. Hinshaw is being too deferential to the politicians, allowing them to make the decisions where in fact she has the authority under the Act. So we're going to discuss that with Professor Lorian Hardcastle, who's a law professor at the University of Calgary. So welcome to the interview, Lorian.
Thanks for having me.
So there's been a fair amount of discussion of this, of the fact that the chief medical officers like Dr. Deena Hinshaw across the country have the authority under provincial public health acts to make the decisions without consulting the government. They could do what's in the best interests of the citizens, but they don't. They see their role as advising the government, then enacting whatever decisions the government takes. Why is that? Why has that practice grown up in Canada?
Well, so I think this is the first time that chief medical officers of health, especially out of Ontario, which did have SARS, but this is the first time in most provinces that we've really been faced with a situation where chief medical officers of health have been in a position to make these kinds of society-wide orders. Ordinarily, what happens is under Alberta's legislation, the chief medical officer of health does have an advisory role with respect to the kinds of public health concerns that face Albertans. And so ordinarily, we would have the chief medical officer of health providing advice under Section 14 of the Act, and then Section 29 of the Act, which gives this power to pass orders. Ordinarily, the kinds of orders being passed under that Act are not the kinds that attract public scrutiny. So it's ordering a single person with an infectious disease to isolate, or shutting down a single restaurant that has E. coli outbreak, or ordering an apartment that has bed bugs to clean it up. And so usually there is an advisory relationship, and then there's an order-making relationship, but it's not the kinds of orders that anybody really pays attention to. Whereas with COVID, what we're seeing is that Section 29 being used to pass these all of society orders. And so this isn't something that's evolved historically. This was something that COVID hit, and this is the way that the response has rolled out, is that these orders are emanating from Dr. Hinshaw's authority under the Act, but the way that the government has politically structured their relationship with her is, well, look, we're going to meet as a committee, we're going to take your recommendations, and then we're basically going to tell you what's in the order.
So if I understand you correctly, just the practice, because it was never needed before, evolved across Canada in one way, but now we're in a different situation. And even though chief medical officers like Dr. Hinshaw have the authority, it's never been the practice for them to exercise that authority in this way. Yeah. And so let's say, for instance, that a government, and I think we could argue the Alberta government has done this, enacts measures that are insufficient, and they do it for political reasons, and then citizens are not happy with that. Can they, and they call on Dr. Hinshaw or any other chief medical officer in another province to exercise the authority under Section 29 and to do what they had not done previously in the best interests of the citizens, which is what the Act calls for, very clearly about that. What are the consequences for that, for potentially for Dr. Hinshaw?
Yeah, so it's an interesting position, and I think it also causes us to reflect not only on maybe how the Act was ill-suited for this kind of purpose, or we hadn't really thought about how the Act might be used with the disease outbreak, but I think another under-theorized and underexplored area is, well, what exactly are her ethical obligations or her legal obligations? Because, you know, she has this duty under the Act to act in the public interest, and then another ethical obligation comes from her role as a physician. As a physician, you have ethical obligations to do no harm and to do the best that you can for your patients. And we're not her patients, but there are those sort of ethical obligations as well. So this is a really sort of strange position to be in, because there are these allegiances that she should have to public health and science, but then the government has put her in this role where, well, you're actually going to wear our political decisions. And that's the strange part to me, is that, you know, we need to rethink the act. And if decisions are going to emanate from government, then the order should have the government's name on them and not hers. And also in press conferences, she shouldn't be the one owning those decisions. And I saw a press conference out of Saskatchewan that I thought was a far preferable approach, where you had, and I can't remember if it was the Minister of Health or the Premier, say, these are our restrictions, these are a balance of economic and health concerns, this is what we've arrived at politically. And then they turned it over to Saskatchewan's Chief Medical Officer of Health and said, look, yes, that is the political, but I also think from a public health perspective that if you really want to stay safe or you have immunocompromised relatives, these are some additional things you need to be doing. And I think that's much clearer messaging. The public gets it. They get that the government's decision is political and the Chief Medical Officers of Health decision is scientific, but Alberta has bled them together in this really unfortunate way. And I think the government is basically capitalizing on the public trust that people have in Dr. Hinshaw and using her as a front for what are political decisions. So for example, when she got up a few weeks ago and said, we're limiting gatherings to 15, that's not science. There's no science saying that you should be meeting with 14 different friends every night of the week at your house. That was a political decision. But when she's the one saying it, it gives it legitimacy that it shouldn't have. And it should have been Tyler Shandro saying, we're limiting gatherings to 15, and then her saying, and the science is that you should limit it even further.
So I guess that creates a dilemma for Dr. Hinshaw. I mean, her role is, I guess we could describe it as being abused almost. I mean, she's being used for political purposes, it would appear. And she does have, as you say, legal and ethical obligations that she has. It's a very difficult position for her.
Yeah, it is. It's a really difficult position. And I do think that, you know, everybody must have a line where the science and the policy get so far apart that you feel like you ethically, morally can't get there and back it up. I'm sure she's thought about that, but I think she's also thought about the fact that, well, if I step out of line and I get fired, who will they replace me with? And there are some doctors in Alberta who have been in the news who are science denialists. And if the government made one of them Chief Medical Officer of Health, the concern is that the little inroads that she's been able to make in terms of pushing back, that person may not even bother with that.
Well, I can see the difficult position she's in, but you know, these are the kind of choices we were forced to make in the face of a deadly pandemic. I mean, there are no easy options here, and we have to ask our officials like Dr. Hinshaw and our politicians like Health Minister Tyler Shandro to make those decisions and then bear the consequences of them.
Yeah, absolutely. I think there are calls for accountability. I think nobody doesn't blame the government first and foremost. I think everybody thinks that they are they bear the number one accountability for this, but I think people are starting to say, well, should she be accountable as well? And should she have stepped out of line at some point? Should she have publicly resigned at some point and said, I can't stand behind these? And I think we're starting to see more people think that, well, maybe that's what should happen. But it's a process. And I think the revelations that came out this week maybe pushed more people towards that.
Lori-Ann, thank you very much. It's been very insightful.
Yeah, thank you for having me.